Good morning, good afternoon, and good evening, everyone. I'm Sofia Gruskin from the University of Southern California's Institute on Inequalities in Global Health, and I'm excited to welcome you to this conversation on where do human rights fit in the global health agenda. We've got an amazing panel of folks who I think you're going to agree have in common the ways that they bridge activism, academia, and practice in the ways that they approach their work, but also all with a shared concern for health and for human rights and how they live their lives. It's really an honor to have this wonderful panel of people here with us today. To try to help frame this conversation, let me start from the perspective that global health can mean a lot of things these days. I'll get to human rights in a second, which can also mean a lot of things. But sadly, if I can say, often leaning towards simplistic biomedical unidirectional, and by that I mean global north to global south, quote unquote, solutions to otherwise complex issues. And nowhere is this more clear than when we think about the world's experience of the COVID pandemic. Maybe the biggest lessons the pandemic has made visible to us all in Los Angeles, where I live, as much as in any other part of the globe, is not only the shameful inequalities that exist within and across all of our societies, but the fragility and the fault lines that exist within our societies. Fault lines that have always been there, but somehow we may not all have been quite so clearly seeing them. And also the commitment, or can I say the lack of commitment, by governments, by institutions of power, and by all of us to do something about addressing them in a real way. COVID is a global public health emergency, but it is equally a human rights emergency. And my hope for this panel is that we can bring together thinking about what are the implications of what we're learning through COVID more generally for the global health, human rights intersection. So like I said, the pandemic has brought into sharp focus the interconnectedness, the indivisibility of all these issues. And that as a world, we really need to do a deep reflection on our values, our standards, our institutions, our mechanisms, beyond just as relevant to COVID as COVID, if you see what I'm saying. And I think one key thing that we've learned is for those of us who are privileged enough to be in these conversations, we also have to be willing to situate ourselves in these conversations in ways that perhaps weren't so stark before, especially we who are engaged in global health, particularly those of us living in and from the global north. We have to genuinely acknowledge the colonialist history of global health, something I'm acutely aware of sitting in a US-based research university as I say all these things. And as a white cisgender woman from the US, noting even some of the limits to the diversity of this panel, part of this is needing to acknowledge our place of privilege. And I don't say that to paralyze us at all, but to help us to have the hard and honest and good conversations we need to have, where everyone is trying to talk and to hear and to understand one another, but from where we are situated and what we bring to the table, but also what we don't. And I feel also, if I may say something about human rights, I want to put out there that we need to remember that human rights, for whatever the problems with human rights, as we know them today, grew out of crises, recognition of the need for some basic societal and international legal rules applicable everywhere to everyone at all times, within which the world can operate. But why they're particularly important to this conversation about global health is because human rights are meant actually to challenge the distribution of power by valuing everyone equally, and require us to interrogate the historical reasons we're in what I would consider to be this messed up situation, the economic, social, cultural, and political backdrop to the massive and entrenched systems of inequality that perpetuate our societies, and what we who care about health can do to address them. So we've tried to set this panel up so that it's less about individual interventions than about discussions around these sorts of issues. And everybody, you all know the drill. Please put your questions into the Q&A function and we will do our best to get to them. And with that, let me introduce our fabulous panelists. So Pascale Allotey, who is director of the United Nations University International Institute for Global Health. She has 3 decades of experience as a researcher in global health, including experience working across 4 continents to promote health and well-being. She's got a multidisciplinary background in clinical health sciences, anthropology, and epidemiology, and her research has focused largely on health equity, health and human rights, gender and social determinants of health, and in everything from forced migration and marginalization to sexual and reproductive health, infectious disease, and non-communicable disease. And she's a technical advisor on several WHO committees and an associate editor for several public health and global health journals. So welcome, Pascale. Rajat Khosla is Senior Director for Research, Advocacy, and Policy at the International Secretariat of Amnesty International in London. He previously worked for the World Health Organization in Geneva, where he served as Human Rights Advisor for almost a decade. In that capacity, he led on research and normative work on the implementation of the Sustainable Development Goals, and in particular on women's rights issues related to sexual and reproductive health. And he guided countries and WHO regional offices on policy and legal analysis, and represented the organization in high-level negotiations and processes related to health and human rights. And he's worked in a range of other places and done independent research and policy consultant work for UNDP, UNICEF, UNFPA, among others. Rajat, welcome. Gregg Gonsalves, who's associate professor at the Yale School of Public Health and the Law School, is an expert in policy modeling on infectious disease and substance use, as well as on the intersections of public policy and health equity. His research focuses on the use of quantitative models for improving the responses to epidemic diseases. For more than 30 years, he's worked on HIV and AIDS and other global health issues, including the AIDS Coalition to Unleash Power, the Treatment Action Group, Gay Men's Health Crisis, and the AIDS and Rights Alliance for Southern Africa. He was also a fellow at the Open Society Foundations and in the Department of Global Health and Social Medicine at Harvard Medical School, and a 2018 MacArthur Fellow. Welcome, Gregg. And Peter Singer, who is Special Advisor to the Director General of the World Health Organization and previously co-founded two social impact organizations, and was also for 10 years Chief Executive Officer of Grand Challenges Canada, and the 10 years before he was the Sun Life Financial Chair and Director of the University of Toronto Joint Center for Bioethics. He was also Professor of Medicine at the University of Toronto and Senior Scientist at University Health Network. And in 2007, he received the Smith Prize as Canada Health Researcher of the Year in Population and Health Sciences. And in 2011 was appointed Office of the Order of Canada for his contribution to health research and bioethics. And he has many other fabulous accolades to his name. And welcome, Peter. So
Thank you.
I hope you'll all agree, what a panel. And, you know, to start the conversation and to situate the conversation together, I want to ask each of you if you could tell us a little bit about the work you do now and how you think about the role of human rights in global health. And Pascale, if you wouldn't mind, I'd love to start with you.
Great, thank you. And hello to the esteemed members of the panel. I'm totally privileged to be with you all in this conversation. I guess just to get straight into it, I came to human rights and global health through the convergence of a number of areas that I happen to be working in. And as a colleague of and friend of Sofia's and mine usually says, you have to start a conversation like this with a story. So I was working in one of the communities in northern Ghana, one of the few communities where women undergo some form of ritual clitoridectomy or infibulation. This meant that they often presented with complications during childbirth, with major tears, which put them also at further risk of fistulae and so on. Now, the traditional procedure was clinically problematic. It was performed by a male traditional practitioner in the community, and the young girls were forcefully pinned down, usually by female relatives, and it was a very public procedure. The rights violations relate to bodily autonomy, to the rights of the child, dignity, so, you know, all the ways, there are lots of different ways to slice the cake. And then I returned to Australia after Navrongo, and found myself involved with guidelines for how the Australian health system would work with refugee and humanitarian settlers who were part of the Women at Risk program from countries in Eastern Africa, many of whom had undergone infibulation as well. Now, here's the thing. One of the challenges at the time was whether obstetricians would respond to an increasing request from women who were de-infibulated for the purpose of childbirth to be restitched to the infibulated state, which had become for them what they considered normal. Now, the law made this illegal, and all of this got mixed up with refugee rights to access some health services and not others, and other issues that were politically messy with refugees and migrants' access to health. But on the labial surgery, it was okay for other Australian women to present to the same health system to request a hymen repair so that they were tighter, or to have labiaplasties that would make them look more attractive when they wore lycra shorts. Now, all of this is to say that I find this, and I found at the time, this an incredibly complex area to navigate, and an area that involves human rights internationally, cross-nationally, human rights nationally, rights as they relate to refugees and humanitarian settlers, local regulation, local policy, and local practice. Now, the reality in global health, however we define it, is that it is ill-equipped to handle these nuances and often tends to retreat to the default argument of what is or isn't within the purview of the health sector. And if we don't want to keep repeating the same arguments over and over again, we need to be a bit more systemic in how we conceptualize and address these issues. So a very long way, of saying that the work that I do now, my work now through the United Nations University International Institute for Global Health, is about being disruptive. It's about pushing to get us outside the inertia of business as usual, and having the same discussions and complaints to being much more focused on solutions. And that for me means getting out of our ivory towers and institutions, whether it's high income, middle income, or low income countries, and engaging in much more genuine ways with people on the ground who frankly are just getting things done in the best way that they know how, and more likely to help with solutions. It's a fantastic job to have because I get to meet a whole range of people, but also to try and put these complex arguments into what makes sense, both for global health and human rights. I'll stop there. Thank you.
Super awesome. Thank you. Thank you. Greg, can I pose the same question to you?
So I'm a little bit conflicted about how to describe this because I live in a country with Sofia, which really doesn't have a set of enshrined social and economic rights. And so a lot of my work on access to medicines domestically has really been with the language of human rights, the tools of human rights is sort of something that's aspirational for my domestic work. I mean, I work in that context, but realizing I don't have much recourse to it in the context of the legal system or the policy system of the US. I think where I learned the power of human rights is when I worked in South Africa and was working with the Freedom and Action Campaign and the AIDS Law Project and the AIDS and Rights Alliance of Southern Africa, and in which the law and the constitutionally enshrined right to health was incredibly powerful in securing access to antiretroviral treatment for millions of people in that country. And so I don't want to overstate or understate the promise of human rights and say it's contingent on where you are, even if the sort of normative values are universal. But I think it's a discussion to have about how we can use rights, when and where and how, and where it's possible and where there are more difficulties and you have to try other routes to affect social change.
Great, thank you for that. And definitely something we want to come back to, I think, absolutely. Rajat, please.
Thanks, Sofia, and good morning, good afternoon, everyone. So to try and situate the personal in the context that, as you talked about, I was born in the walled city in Delhi and to middle-class parents. So the idea of social justice, access, denials of access to services was all too very real and part of our conscientization process in growing up. Fast forward a few years, I trained as a lawyer and ended up practicing law in the courts in India. And some of the social action litigation that I worked on primarily dealt with issues related to disaster relief and access to compensation and remedies for the victims of such disaster, and access to services and healthcare services included, and just canvassing the range of issues that individuals confronted with for accessing the very basic services that they needed to be able to deal with the kind of trauma that they had suffered. In my job now at Amnesty International, which is a human rights organization working on the full spectrum of issues, we look at the issue of health as a human right as a core of our mandate for the work on social justice, but also as part of a larger agenda that we are trying to develop and address on inequalities. In doing so, we look at three intersections. The first is looking at the rights to health. And by that, I mean rights in relationship to access to services, goods and facilities, social determinants, and the kind of inequalities, challenges, barriers that individuals and communities face across the world. The second is the impact of realization of human rights or denial of human rights on individuals' access to and realization of their health to the full potential. And this is something that we do, for instance, by looking at issues in terms of freedom of movement, access in terms of freedom of expression, and all the issues which became all too very real within the context of COVID-19, when we look at issues in terms of the lockdown state, overreach, which we looked at mis and disinformation, and we looked at issues in terms of what was happening in the care homes, or for that matter, vaccine equity, which I'm sure can delve into deeper. And then just finally, something that I think we do not talk about as much as we need to, but which is increasingly becoming obvious, especially coming out of the COVID context, is the impact of other state actions and policies that impact individuals' realization of their health and human rights, from tax, fiscal policies, to zoning permits, to how cities are designed, and other issues. So when you look at the question that you asked us in terms of, so what is then the role of human rights, is from a framework to understand disparities, from cardinal entry points to understand and develop programs and solutions, but also in terms of emphasis on the importance of law, and how law is one of the things that undercuts, in a lot of circumstances, individuals' ability to access and realize their human rights. Thank you.
Thank you. Thanks. Super helpful. Peter, please.
Thank you, Sophia. And first off, it's very humbling for me to be here with such a terrific group of scholars and activists in human rights. From the standpoint of the World Health Organization, human rights suffuses everything we do, but let me hit three highlights. Firstly, it's baked into our Constitution, which is almost 75 years old, where it says, as I think everyone knows, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. And I think that's a very important normative basis for all of us, echoing some of the points that Gregg was making. Secondly, to make it a focus of continuous improvement in the organization, it's central to our current strategy, which is called the General Program of Work 13. And not only is it very central to the strategy, but it's also measured on a balanced scorecard in our annual results report. And so every single activity of the organization does a self-assessment on gender equity and rights. And that's a substrate, shall we say, for continuous improvement. Thirdly, I feel very proud to work at WHO, to have come with my brother Tedros. I really think that WHO and Tedros in particular, over the past few years, especially the last couple of years, has been a voice of moral clarity on global health equity and human rights. From issues in vaccine equity to issues in universal health coverage, I think the implementation of human rights requires leadership at all levels. And I feel very proud of the leadership that Tedros has shown every week, highlighting issues of inequity vaccine inequity and others in the COVID response, but also more generally, universal health coverage. So look forward to the conversation, Sofia. Those are a few highlights, but the World Health Organization is obviously very committed to human rights, and it suffuses everything that we do.
Thanks for that. And thank you, everybody. I really appreciate how you've all situated this conversation from where you come from. And I want to point out how differently you all answered this question. So I think that's lovely and really gives us a base to work from. I want to go back, Rajat, actually to something that you said when you talked about the right to health specifically. And, you know, and the work that you're doing with Amnesty around framing health as a human right. So why does it matter, do you think, to frame health as a human right? What's changed, shifted, crystallized in our understanding of the right to health in this phase of the pandemic as well? If you could start us off, and then I'm going to ask everyone else to please add in. Rajat?
Thanks, Sofia. And indeed, it will be great to hear from colleagues as well. And let me try and answer the question in two parts. Let me first try and deal with the first part of your question in terms of what difference does it make to frame health as a human right? And then let me come to what changed due to COVID. To start from the start, I think Peter just said that with the reference to the to the WHO Constitution. And why does it matter in terms of framing health as a human right? Because it puts the emphasis that it is a matter of law, not the whim or fancy of an individual, of an institution, of a government, but it is a matter of the law that we are supposed to be addressing these issues as part of individual rights. Now, many would argue, what difference does it make? Look at all the violations, and let's indeed look at the violations when we come to the other segments of a conversation. The second is the issue in terms of it underpins the ideas of justice and accountability. What happens when things go wrong? What happens when an individual is indeed denied access to services that they are so entitled to? What systems and avenues are open and available at the national, local, but also at the global level to seek remedies? And that's what human rights framing bring to the conversation, is the idea of justice, but also the idea of remedies. Thirdly, what it does is puts emphasis on people at the center of health policy decision-making programming. It's not a biomedical conversation in ether that can be divorced from the lived realities. And that's what it brings, is context and people into the conversation and back as part of the central process. Fourth, what it does is forces us to think about processes, not only just the outcome. Many talk about leaving no one behind as almost as a juxtaposition of human rights or calling human rights in practice. It's a fantastic concept, don't get me wrong. But the question is, and what human rights forces us to ask is, why do certain communities get left behind? What are the policies that forces those communities to be left behind and disenfranchised? And that's what it brings. And then finally, what it brings to the conversation is the issue of voice and participation. That individual should be part of the decision-making that impacts their life, not just some technocrat sitting elsewhere. What shifted with COVID? All that I said, we have known that ever since the International Covenant on Economic, Social, and Cultural Rights, or for that matter, the WHO Constitution from 1948. What shifted was that it forced this conversation to the center of health policy and decision-making. It brought it from the peripheries to the center, and so the marginalization of human rights broke down, and it became a center point of an edifice. The second is the issue, the issue that we were forced to address was not only in terms of how state policy making was happening, how state was instituting these exceptional measures to derogate right, the state overreach, and how that was happening, but what it brought in, and what many have talked about, increasingly so, and actually Peter being one of them, is the issue of corporate power. One of the key takeaways from COVID realization is that what unwielding power that corporate actors, not just the pharmaceutical companies, but corporations hold in terms of individuals' realization of human rights across the populations that we are talking about, and what are we going to do about that? I'll leave it there, but would be fascinated to hear others' reactions to this too.
Thanks for that. Gregg, can I turn to you? Anything to add?
So what's interesting to me in the context the sort of framing of human rights in the COVID pandemic is it gives us a language to talk about what's happening. In many places, things are described as a difference of opinion or policy disagreements. Whether it's access to vaccines around the world or the way we dealt with the pandemic, both in the UK and the US, that these were just differences of opinion. I think many people, not just from the human rights field, have understood what's happened around the lack of vaccine access, the gross human rights violation, the way we let people in meat packing plants and poultry packing plants and warehouses in the US and in prisons in the US just get infected at enormous numbers as another set of human rights violations. It wasn't just a policy choice, which depends on which side of the political aisle you're on, is that we had a normative framework to say this is wrong, right? In which to take our policy choices and put them through the filter of human rights gives you a place of clarity, I think. And sadly, I think Rajat was hinting at this, but sort of corporate and private actors, as well as sort of governmental actors, felt free to run roughshod over human rights for the past 2 years in a sort of in the most grotesque ways, right? In a unprecedented crisis, the right to health and a whole number of other rights really fell by the wayside as politicians made expedient choices or politically popular choices rather than doing the right thing.
Thanks. Yeah, totally. Pascale.
I don't have much to add from that incredibly eloquent introduction from Rajat and the addition from Gregg, but I do want to add one point to it, which is that I think given my personal experience has been in quite a few countries where the human rights language is not used very often, or is kind of almost an anathema to the way that people work. I think what the COVID examples and the very specific examples that have been raised by both Rajat and Gregg have done is at least they have provided a framing, even if it's not using the human rights language, it's provided a framing around which a lot of the equity issues have now been drawn out. So it is possible to talk about what, that all the advantages that Rajat mentioned, that, it gives us a way to talk about things, have been adopted and co-opted, but using the language of equity and the language of leave no one behind, which I think is a particularly powerful one. So it's been incredibly important and incredibly useful, even if we just took the COVID example more recently.
Thanks. Peter.
Thank you, Sophia. I mean, just to agree with Pascale and Gregg and Rajat, look, I think the top 3 lessons of COVID and the pandemic have been equity, equity, and equity. And we've all just talked about the normative basis that is relatively strong. But I think we have to ask ourselves how well those normative values have been translated into practice. And I think the headline here is lost in translation. And, I have to tell you, I feel very, very sad and disappointed on this particular question. And just to take one empirical proof point, it is take the example of vaccine equity, recognizing that there's inequities within countries and between countries. On vaccine equity, Gregg has done some modeling that suggests that going forward, if we achieve vaccine equity targets, simply the distributional issues, not more vaccines, just how they're distributed around the world, you could save around 1 million lives, if not more. And I would say looking backwards, it's logical to guesstimate that at least that many lives have been lost from vaccine inequity. And that is a terrible, terrible, and very sad thing. It really makes us wonder about some of our fundamental values. Do we really are we really acting like we are our brother and sister's keeper? Do we really love our neighbor like we love ourselves? And unfortunately, part of this is who you describe as your neighbor and the othering that happens, which is the basis of many evils, from racism to climate injustice to vaccine inequity. Because, you know, underlying the value of equity is the value of solidarity, and underlying the value of solidarity is the value of empathy. Because without empathy, you don't care about solidarity, and without solidarity, you don't care about equity. And so, to me, that's the core question, Sofia, is have these values been translated? Have the values that we all mouth and say that we hold been translated into practice during the pandemic? And I would say, at least on the issue of vaccine equity, and perhaps more generally, the answer to that question, unfortunately, is no. To me, the heart of the issue is the othering, or the feeling of empathy we have for people who may not be in our immediate family or immediate vicinity, and who may look or act or worship different from us. And to me, that's the core of the issue. So how do we build that empathy to build more solidarity, to build more equity? And I know we'll get more practical on solutions, but at this pivot from the normative to the solutions, I just put forward, love to hear what others think. I think the experience has been very disappointing about translating the values we say that we hold into concrete results, shall we say.
So can I just push on that a little bit? I hear you, and I think everyone on this panel believes in this vision of health as a right. I think the issue has been translating this moral imperative into action, right? That's where the rubber hits the road, but that's where the issues are. And you've pointed to where this has failed in the last 2 years. And the question to me is, are there examples from anybody about also where this has worked? And are there examples in terms of how, as a society, we've translated our values into action? And I ask that because I do want us to get concrete about solutions, but I think this is the base from where we need to start. Peter, can I come back to you first on this? Is that okay?
I think there's some terrific examples, and you're right, Sofia, we have to balance pessimism with optimism. It's the only way to move forward and to continue to tackle the global and local challenges that we face. I think there's been some great examples in communities of leadership in communities, and after all, pandemics start and end in communities. So whether that's you know, Indigenous communities in Canada, for example, who take leadership on vaccination, even in remote places. Whether it is the Black community in Toronto that actually mobilized, pushed for disaggregated data at the local level, showed the great inequities in COVID attack rates, for example, and later vaccination rates in their communities, and then use that data to close those gaps. And that case has been documented by Kwame Mackenzie. So I think there's been some great, and that was a case of community mobilization. I think that's where a lot of the positivity has happened, as Pascale mentioned earlier, on the ground in terms of community leadership. And of course, there's amazing progress in science with quick arrival of vaccines and so on. There's many positive things to hit. But I'm afraid to say that 1 million lives hanging in the balance, and 1 million deaths to date is not a fantastic result, notwithstanding the various bright spots of optimism. Local production of vaccines would be another, because that's a way to make the response to some of these vaccine inequity things sustainable at scale. So many bright spots. You're right to ask for the balance between optimism and pessimism. Yeah. But I think the starting point has to be, you know, a few million deaths is a few million deaths too many. One death is too many. And here we're talking about millions, and simply from distribution of a life-saving commodity. And that makes me feel very sad.
100%, 100%. Pascale.
So I want to, without putting you on the spot, Peter, but just you raised, and a few others as well have raised the point about the importance of values, and that is almost always the sort of thing that underlies the discussions around equity and so on, and how important these are. And the reality is, at the very least, in the early part of the pandemic, leading up to the development, establishment of COVAX and so on, there was a very strong value system. I mean, listening to it didn't matter whether it was, with the exception of a few leaders, obviously, the language was very much one of equity and all of that. So the intention is clearly espoused. But in the operationalization, once the vaccine was available, all of that changed. And it's not, and I've seen your kind of your communications through social media and so on, and others have used very strong language about greed and that sort of thing across different countries. But there is, and this may be a problem with global health, there is the challenge of what is required in terms of equity at the global level and the solidarity and all of that, and exactly how that translates at the national level. And I don't know that we have the mechanisms to be able to deal with what it means when you have a national health system that has national targets and so on, that also need to be translated within a global context of solidarity. And I think this is a reality, and one that the human rights is particularly has problems dealing with, because it's kind of, well, we all need to be equal. So it doesn't allow for the realities of these nuances. And so I guess the question, or just kind of raising the issue is that are there examples, or how does one work on this kind of the tensions that are created at the global versus the national?
And that seems very much something I think we can come back to, and I hope we do come back to. I'm conscious of the other little hands that are up. Rajat, I think your hand was next.
Thanks, Sofia. I'll be very brief because much of what I wanted to say has been said. You know, from Tedros to Guterres, everybody has actually, you know, made a very categorical statement from a leadership perspective with regards to, if you know, COVID-19 was a test of global solidarity and a test that we have miserably failed. And there is a level of sadness and truth to that statement that we must acknowledge, because this is the foundation of the very UN Charter that defines the opening paragraph of the UN Charter starts about we take upon the duty to cooperate to address the issues that are identified in Article 1. And it's not like we don't know how to cooperate. We bloody well know how to cooperate. We are choosing not to cooperate in this thing. We are putting policies which are no better way to describe, but which are me first and filled with greed only. Because there are mechanisms and processes through which we have cooperated. If you look at actually, if anybody goes to the UN Security Council discussions on the counterterrorism week, you will see the entire world security apparatus coordinating with them like clockwork. So you know how to do it. You are not doing it right now because you're making a decision that there are certain lives worth dispensing with. And that's the harsh reality which we have to acknowledge. And that's where the greed of this entire thing, because you see, 2021 should have been the story about the other part of the global cooperation. Vaccines came into being because of global cooperation. It's not a story about global solidarity and the success of vaccine heroes. It is a story about greed. And then just to say, finally, I don't know who said about what mechanisms that apparatus there are. WHO set up COVAX, but we no longer cooperated with COVAX. What do you want in terms of more to happen? When countries after countries are making those calculations and pharmaceutical companies waiting in the lobby wings, making sure that those decisions from TRIPS waivers to other things are not passed, there is a calculation, there is a greed that is underpinning it, and there is the inequality in the world that we have created. Yeah. And that's what we have to discuss.
100%. Yeah, absolutely. Greg, please.
So lost in translation is the nice way to put it. This was about the predations of private power, right? Everybody's celebrating Albert Bourla and Stefan Bancel for bringing us mRNA vaccines, right? But these are two men who are holding the world hostage for their own private gain. And then there's the capitulation of CUGH, right? CUGH, I've known Seth for 30 years. He could have easily said, it is indefensible that we set targets at 22% or 25% early on in the pandemic for vaccine coverage. If you'd said that in any of the countries that we're sitting in now, people would have gone berserk, right? So there's a capitulation at the level of the UN. And then there was, we in the US, we all like to, crash Donald Trump for his performance during the 2020 first year of the pandemic. But the second year of the pandemic, we lost more people in the United States than we did in the first year. Right. And it's not just sort of the Make America Great crowd. It's the American liberals who do not want any change to happen at any cost to themselves. Right. So you have people like David Lenhart, who's a writer from the New York Times, Lena Wen, who's the former health commissioner of Baltimore, saying we need to get back to normal. We've had 1,000 deaths per day in the United States since August. Right. We have we have less than 10% of people in many countries unvaccinated, when we're all talking about second boosters in the United States. And so this is not about lost in translation. It is about deliberate indifference and malign intent. And when we talk in human rights, we never want to use the word power, right? The point is that we have to build power, right? We have to confront private power and build public institutions, because that's the only way we're going to get out of this in the long term, right? And, if we couldn't do it for the worst pandemic in a century, what are we going to do for climate change, right? James Baldwin has this phrase that is the title of his book: God gave Noah the rainbow sign, no more water the fire next time, right? If we've screwed up so badly in 2020 and 2021, what does it offer us for prospects for the next few years? This is not about human rights in total. It's about a global realignment of power and how the private sector, in collusion with governments and sometimes UN agencies, has allowed us to get to this point.
So totally, and I think it raises really this question about the kind of where do we go, right? So in terms of thinking about this persistence of inequities in power that just grow and grow, this persistence in human rights violations, as I'm going to put it, but also this challenging geopolitical context to live on health. Isn't there a need now to rethink something about the human rights regime, and particularly our approaches to accountability? Don't we need to kind of open a conversation about what that looks like? And can I go, Rajat, can I go to you, please, for that?
Thank you. I don't think what we need to rethink is the question of human rights. But what I think we need to do is precisely what I think Gregg was taking us towards, is that we do need to reconceptualize issues on how we approach aspects such as those of power and power differentials, not only in terms of interpersonal power aspects, but also institutional power and how power is being negotiated, realigned. But I have to be, I'll take it a step further, actually. I don't think there is a problem with the concept of human rights, as some would like to call it. I think that, as you started detailing, Sofia, in your opening remarks, human rights came as a reaction to the crisis that the world confronted with the Second World War, and from that came out the modern incarnations, I should say, of human rights as we see it in UDHR, the international covenants, and so on. The problem that today we have is that of tactics, and unfortunately, what is failing is our tactics, because what we are confronted with is an opposition that has not only co-opted a lot of these issues as part of their daily jargon. If you look at the statements that come from IFPMA, for instance, on what they are doing on this, there's no problem. We are dealing with a very good situation right now. So that first thing is that we need better tactics and strategies. The second is something that we have been extremely naive about in large parts of our work, I have to say, is the recognition that politics matter, and that we do need to address the issue of politics, left, right, and center, on how we address some of these issues. There are incredible learnings that we have from the HIV/AIDS movement, which we haven't just learned from. And that is where I think we need to feel the frustration on how do we take those learnings and apply them to scale, and how do we address the issue of national level politics, ruling ideologies on how policy making happen. The thing I would like to say is recognizing and factoring the role of non-state actors. I spoke about corporates and colleagues did as well, and we do need to factor in how the corporate power is being wielded and the role of pharmaceutical companies, but also investors. The investors into these pharmaceutical companies who are actually thriving from the riches that these companies are making. If you just look at Pfizer and Moderna, eye-watering profits last year, $54 billion. But where we are in terms of their vaccine equity commitment, less than 2% went to low-income countries. So we do need to address going forward. And then the final thing is in terms of architecture that we are dealing with. Something that I think we should talk about more is how do you address the brokenness of the architecture that we have been confronted with. And we are in a situation where the mechanism and the apparatus that should have kicked in to address some of these issues just stood there silently for the last 2 decades and enacted on the issues that should have been met with moral outrage. And so I think that's where I will try to situate it rather than start from the point that there's something cardinally wrong with human rights as we know it, but more on what do we do with it.
Thanks for that. And before I ask Greg for your thoughts on this, I just wanted everyone to know that Pascale's internet went out, so she's dropped off. All right, just for everybody to know. So Greg, please, your thoughts.
So human rights is a language, right? Like epidemiology is language. It can tell you things, right? It can offer an interpretive tool about what's happening in the world the same way epidemiology can. The point is that description is not enough. And I think what we're seeing in the context of the COVID pandemic is that in the face of gross human rights violations, and they can be enumerated in report after report in very detailed ways, but in many places we have no recourse to redress those human rights violations. And when we try, we don't face off on the terrain of human rights. We face off on the terrain of politics, and we face off on the terrain of power and money, right? And so, there's a whole group of people who've been working, who've come from the Access to Medicines movement, who've been working tirelessly since 2020 on sort of the idea of a people's vaccine. And it's all the old people we know, from like Fatima Hassan from Health Justice Initiative in South Africa and others. People have not given up, but they've met an immovable force, right? And it is these private actors in collusion with governments and sometimes again with UN agencies that have basically stymied us in this regard. And so again, human rights is a tool. It's a descriptive language. It has to be yoked to some sort of implementation. There has to be an implementation science of human rights, right? How do we implement human rights and realize them not as an aspiration, but as a deliverable in terms of achieving our goals, even in places like the US where you can't use the language as a legal tool in many cases.
Peter, what do you have?
Yeah, I mean, you asked about bright spots before. Almost ironically, Gregg's Twitter feed was one of the bright spots through the pandemic, and the type of advocacy, evidence-based, that he's used and Fatima has used, I think has been a really, really positive contribution. Let me just say a couple of things. Firstly, one empirical surprise has been the importance of trust in the pandemic response. Everyone was measuring international health regulation capacities and stuff. And then you have this empirical work from Council on Foreign Relations, IHME, that shows that the principal determinant of pandemic outcomes is actually trust, and trust in national governments. And in a sense, trust is the byproduct of leadership. Leadership is the most effective vaccine. And that just is a way I'm just kind of capsulizing some of the points that I think Gregg and Rajat made about the importance of leadership and politics in these issues at all levels, from heads of state and international organizations down to communities. Where I wanted to focus was on the corporate side, and Rajat mentioned this. I think the group that still needs, I don't know what the right way to put this is, and maybe Gregg will help to shape it in a different way, but I think the group that still has not yet been fully tested, shall we say, in terms of this is investors. And and I don't know whether this particular strategy will work or not. So let me just be clear. I'm not presenting this with rose-colored glasses and as a panacea, but it is something that I think is worth trying. When what drives the behavior of corporations is their boards and the investors. And so the question is, if one really engaged investors, would they move closer towards some of the social goals that we all hold dear, like vaccine inequity, and writing that? And there's some lessons from climate, both positive and negative in this regard. So here we see, for example, the work of Amnesty in the report carding, and Rajat capsulized some of it, company by company, what proportion of vaccines are going to low and middle income countries? And have they been sharing their technologies, for example, with the WHO hub? That kind of accountability information, I think, is important to drive change. And then on the effector side, you see some shareholder resolutions, like the shareholder resolution from Oxfam for sharing technologies with the WHO Technology Transfer Hub, like the shareholder resolution from UNU-IIGH, a group of investors, to link executive compensation with vaccine equity and with other goals. So, the annual general meetings of these companies are coming up. Those strategies are in play, and I really think they're worth following very closely. I don't know whether that strategy or the tactic, I guess Gregg was talking before about the tactics and the implementation science, that's a piece of it. I don't know whether it'll work or whether it won't work. I think it's worth a try. And I also know that it probably requires repetition and time is short. But, just building on the points that Rajat was making and to some extent the points that Gregg was making, this is an avenue that I think deserves full explanation. And I would call upon everybody listening here to kind of pressurize the boards of companies, investors, really to focus on the performance of individual companies. Not only in sharing vaccines, because we now know that the focus has shifted from supply alone, and it's more about reliable supply, as Fatima Hassan has really highlighted with the drip thing, to also the sharing of the technology, because there will be a new vaccine, there will be a new pandemic, there will be a new variant, and so local production becomes very important. So both those things are important, sharing the vaccine and dealing with the distribution bottlenecks and sharing technology. But anyway, I think this strategy of investor engagement, shareholder activism is worth a try as a tactic to move towards some of these right things. Be very interested to hear from Rajat and from Gregg and from yourself, Sofia, about how we can actually all work together across the NGO, the multilateral, and even the corporate parts, because UNU-IIGH, for example, is a group of investors, just not the biggest investors in those companies, to help the companies move towards these social goals. Mm-hmm. And again, before Gregg comes back, I'm not presenting this as a panacea or something with rose-colored glasses or something that's definitely bound to work. Basically, I think it's worth a try.
Totally. And I really appreciate the focus then on the private sector. And we are also thinking also in terms of what does it also mean in terms of engagement with nation states, right? And with governments, and what does it look like in general in terms of if we're trying to move from kind of talking about this to the doing of it. And I really appreciate this is a doing example in terms of what can be done. Gregg, I do want to turn to you. I mean, in terms of a better world, you've written that there's enough of us to organize and push back and push ahead. So that's a really powerful statement, right? So what can this look like? What is it going to take to get us there?
So a couple of things, we're at a coalition of universities here for global health, talking to probably people who are at academic institutions across the globe. The way we teach public health is largely as a technical enterprise. And Ed Young, who's going to be here at Yale next week, talked about maybe public health participated in its own downfall. Because if you look at the history of public health, in the 19th century, it was about social change and campaigning to reduce poverty, to change housing conditions, et cetera. And sort of with the microbial revolution, we went for the tech fixes, right? And so what students learn in public health schools are that the sciences of public health, but not the sort of sciences of power and social mobilization, right? I don't think there's any way around it, but to think about how do we use the mechanisms of public health and human rights to build power. And that means, you know, helping to support local advocacy and build international networks that can do this work together. You know, it's not lost on all of us that the Treatment Action Campaign and ACT UP and these relatively small social movements were able to achieve great gains during the AIDS pandemic, but it wasn't enough, right? The sheer strength of private power, corporate power, and sort of their government and other allies needs a much more massive mobilization to really sort of bring us towards a point of big structural change. That means how we teach public health, how we teach global health, and how we teach human rights. So we build a new generation of people who are going to fight for this, right? Because operating on the train of the current system has brought us to the precipice, right? We're going to have how many dead in the United States within a few days? 1 million dead, right? 1 million dead. When we talk about the global toll, think of that as well. All not perhaps preventable, but at least in part preventable. And so, dealing with the investors is great. Bailey Gifford has a huge stake in, I think Pfizer, or is it Moderna? I can't remember. They've been approached. People have reached out to them, but they haven't made a move yet. And so, it's a little bit about the sort of depending on the kindness of strangers. Their incentive structure is not to help us. And it's not to sort of support sort of human rights norms. The almighty sort of dollar or whatever currency we want to talk about is what they're aiming for. And there's only so much shame you can bring to the table to get them to sort of change their ways and pressure the companies in which they invest in. So again, I think we have to talk about the logics of power, the way we train our students, the way we shape our fields, and really think of ourselves as a worldwide social movement, rather than sort of a bunch of technocrats trying to sort of finesse our way through the problems of a giant pandemic, which is really out of control.
Thanks for that. And I do want to remind people that the Q&A function is open. So please, if you want to add your questions and your comments. Peter, can I turn to you?
Yeah, I mean, I just pick up on Greg's point about incentives. I think that's what we're in the process of testing, or that's what people are in the process of testing. So for example, if you're a universal asset holder, like BlackRock, and there's another variant, and the market goes down, since you own every company in the market, you'll lose more financially than you will gain from your investment in any individual pharma company. So that's an incentive. If you're an activist, an active investor, Bailey Gifford would be an example of that. There is a element there of a reputational element that's very important for activists, for active investors, not activist investors. And if you're an ethical investor, like Church of England, then you really have to show consistency. So I think Gregg is absolutely right to point to the values of investors. And I think there's a potential coalescence of values with movements towards greater equity. But again, who knows? Just pivoting, I fully agree with Gregg about the importance of self-organizing social movements. And Ben Phillips has made this point very well as well. Especially when you look at young people. To take a concrete example, there was this group of young people called Vaccine Hunters Canada. They found a mismatch between where the vaccines were being distributed and people's information about where to get vaccinated. And they found a problem and solved it, set up the website to do it. It's a very small example, but it is an example of self-organizing young people finding a problem and solving it. And so I do think that Gregg is right to point towards social mobilization. And the more that can happen across sectors, the more we can actually form a coalition among, let's say, the large multilateral agencies, the UN agencies, the civil society groups, and even private sector groups and investors. I think the stronger that movement will be. You know, to come back to the basic issue, what's happening is just not right. And it's important to motivate people, including as the world's attention shifts to other things, because the fundamental issues are the same. The fundamental issues is whether we value the fundamental issue is whether we value every human life anywhere in the world as equal. And that is the fundamental issue of human rights. And the problem is how to translate that into practice and how to build empathy for somebody who's not immediately in front of us, and how to live our values and act accordingly. Just to go back to the overarching narrative, I think, that we started with.
Yeah, and so Rajat, what is it going to take for us to get there?
Thanks, Sofia. I want to build on what Gregg and Peter have talked about. A small point on the investor issues and the incentives that we are talking about. Just want to add to the list of ethical investors and targets that Peter was talking about, adding to that pension funds, who are one of the biggest investors. And going back to our original point of departure, making it personal, it is our pension fund. We have a right to ask these questions. And I think we must ask these questions because it is our pension funds that are being snowballed as investments into these other areas alongside. But I want to go back to the point about mobilization and change. And absolutely, leadership today is coming from people on the ground, not from those in positions of power. And that's abundantly clear. Look around the world, and any example from Colombia to Myanmar, and you will see what is happening in terms of, and Hong Kong, on people marching on the streets, demanding change and getting the change. But I do want to add something there. We do need to look at it in context of what's happening to civic space around the world. The shrinking civic space, the implementation of draconian measures, which is silencing the voice of civil society, muzzling any thought of dissent. 67 countries last year alone implemented new legislations to silence journalists and civil society and human rights defenders. I work in the world's biggest human rights organization and have all the power and privilege that comes with it. But we have had to close 2 offices in India and Hong Kong in the last year because of the state muzzling of dissent and freedom of expression. How do we support civil society in those cases is a larger question. How do we ensure, and going back to the point that was being previously made, how do we give them the power? What I'm equally upset about is civil society not having a seat on the table when the discussions are happening. That civil society has been blocked out of the UN for the last 2 years and hasn't had access to the UN because of COVID. Everybody else can enter the United Nations, but civil society could not enter because of COVID. There are negotiations going on all sorts of issues, pandemic treaty, new mechanisms, etc. Where is civil society participation? And I think let's make the call for social mobilization, but it has to come alongside the recognition that what is happening to civil society today is deeply disturbing, and we will not effect the change only on the backs of them without actually giving them the power that is needed.
So let me pick up on that if I can, which is, thinking about the ideal role of civil society, right? Just to say, what would be needed to mitigate the concerns that you raised? And while I'm, asking questions, and I'd like to open it to the 3 of you, when you think about, Peter, the role of WHO, when you think of the role of multilaterals, what's the role of multilateralism in moving this forward? I would really appreciate thoughts from each of you around this set of issues. And I don't know, who would like to start? Rajat, would you mind?
Sure. I'm happy to kick it off. On the first part of your answer, what is the rule? I think what do we do? I think it's a very challenging conversation. And I think this is where we do need to look at, when we look at the issue of civil society, we do need to look at the role of technology and tech platforms, and how, while the physical civic space is being restricted, how we can use the online civic space to expand the civil society. But we have the challenges there in terms of how tech companies are approaching some of these discussions, and then the challenges that exist alongside. The meaningful role of civil society is to have them as partners on the table, not as an optional add-on, but as a key stakeholder for representation of the voices of people into these global processes and conversation. And that's when we will see some meaningful change happening. On the question of WHO, I've worked with the institution, and I don't want to sound as an apologist for the institution, but I do want to refer to something, Sofia, you and I wrote with Pascale, is that there is increasingly a tendency that we are seeing not only for the World Health Organization, but for multilateral entities overall, is that they're increasingly being used as a fig leaf or a whipping mule by the member states to either whip them or to hide behind. If one needs to have a serious conversation in terms of what about multilateralism, let's start with the conversation about the conduct of these countries within these institutions and domestically. It is not a news to anybody that the US president did actually withdraw from WHO in the middle of the pandemic. A number of countries refuse to cooperate with any mechanism that is set up. So these are the institutions, what you make of them. And by all means, criticize, by all means, reform. Peter is part of a reform process himself, 5 years he has spent. But somebody needs to ask the question, what about these countries who are increasingly running these institutions to the ground? They cannot even agree on their budget and increasing the budget even within the pandemic. What are we talking?
Yeah, I mean, I could jump in, or I don't know, Greg, if you want to go first. Or, yeah.
Go ahead, Peter.
I mean, firstly, very concretely on civil society, and I only say this partially tongue-in-cheek. I think a very concrete move that I'd love to see is Fatima Hassan on the board of Moderna and Gregg on the board of Pfizer. Or, and by the way, the reason I said it's only partially tongue-in-cheek is because some of that shareholder activism in the climate space is around election of directors. So, there's a concrete idea.
Sorry, go ahead.
On the issue of, and then I think they should televise the board meetings, because that would be really interesting. I think, but I say it tongue in cheek, but I'm serious, A, about the potential tractability, and B, about the potential effect. And obviously one person is not enough in a group of people, but secondly, on the multilateralism thing, let me start with the positive. I am not a UN lifer, and I came to WHO actually with mixed feelings about WHO. I thought this 194 member state thing, big bureaucracy, it's messy, sometimes it's inefficient. But what I've come to realize is actually the value of inclusive governance. In a sense, WHO is the G194 for health. And inefficient, messy though that may be, it is essential. And it's when you get smaller and smaller and smaller groupings from a governance standpoint, I think that's when you really run into trouble, frankly, with some of the equity and rights issues. So I think that's a very important platform. And Tedros has convened member states every week, including, he also convened the media every week, but every week to share good practices, et cetera, all of them, not a subset of them. And I think that's really, really a key asset. Just almost musingly on the reform side, some people seem to find it hard to talk about WHO without having the word reform in their first sentence. And that is a form of positioning, because we don't say, for example, Oh, CUGH, great organization. It needs to be reformed. New York Times needs to be reformed. It's not the first thing that we say, although it is sometimes the first thing Gregg says about the New York Times specifically. But the point I'm making is when you start your first sentence about WHO by saying it needs to be reformed, and as Rajat pointed out, there is an ongoing reform for results, measurable results. That's already positioning. And the acid test is actually whether the speaker is dating the beginning of the pandemic to March 11th, the so-called declaration of a pandemic. We don't declare pandemics. Or January 30th, the date on which a public health emergency of international concern was declared, which is the highest declaration in international law. So anyway, I think multilateralism is essential. I've become a convert, actually, even though it's messy. I think it focuses on the most vulnerable in the world, but multilateralism with results and the inclusive governance being a key asset. And, you know, we talked a lot about vaccine equity, Sofia, this is the last point I'll make, but it's in the broader context of human rights and universal health coverage. And just to put a number out there, we had these triple billion targets. Universal health coverage is an SDG, a sustainable development goal. To get to the 2030 goal, we estimated you need about 1 billion people newly accessing health services without financial hardship in every 5-year period. That's one of our triple billion targets. And of the billion target, we project that the shortfall, not the attainment, the shortfall before COVID was 730 million, and after COVID up to 840 million. So the attainment of that SDG is less than 1/3, to put it generously, probably less than 20% of what is needed. And we really need to accelerate that coming out of the recovery. And that's the kind of thing I mean by multilateralism with results. Starting with that kind of number, that's the burning platform. And then asking ourselves, how do we actually accelerate? Or in our case, support countries to accelerate progress. It's that type of translation. I think that's in part the tactics, or at least the pathway to the tactics that Gregg was talking about. And I use that as an illustration of the beginnings of multilateralism with results and multilateralism with inclusive governance.
Super helpful. Thanks, Gregg.
So, you know, I like the idea of multilateralism, but, you know, the WHO is experts talking to experts, the agency talking to health ministries. And, you know, civil society has become, I think Rajat is talking about the tokenism that we see in the context of some of international agencies, but also wherever you go, you know, you have an NGO representative on this board or that board. The point is that if we're going to reach any of the sustainable development goals, any of the targets outside of COVID, it can't be just sort of physicians, healthcare workers, and technocrats, lawyers, epidemiologists who are part of this big tent, right? We have to figure out, you know, some of us bring legal expertise to the table, clinical expertise to the table, epidemiological expertise to the table. You need to bring people to the table who can bring people to the table, right? And so civil society needs to be people who can mobilize, right? It's not, you know, we've professionalized social movements so that we can have people who have no connection to their countries, who are at the table in making decisions. You need to be able to build movements across the world. And yes, I understand this restrictions in many countries of civil society in many places, but you know, if we can think of the WHO as not just sort of a discussion among health experts, but among civil society as an equal partner, and people may say, oh, why do you need that? If you don't understand the way in which social change has happened, in which health advances have happened, that some of it is not about the medical and the public health expertise, I don't know what we're doing. So I really want to figure out how we can sort of bring more people into the mix, and not sort of the elites from international and multinational NGOs and even local NGOs, but really to build up the ability to sort of push change at a local level, and then use that sort of local expertise to push the agencies to sort of help it along. And WHO and UNAIDS in its best iterations and best moments has done that. I remember the original 3x5 meeting with Jim Kim, like, you know, a gazillion years ago now. And there were a lot of people in that room who did not want to talk about the expansion of retroviral therapy. And Jim knew what he was doing. He put he put people in the room who would basically call the question. There's 10 civil society people in that room, many of them who were just coming from their communities to Geneva that day. And you could see the difference in the conversation, because there is not parity in the numbers in the room, but the power differential was much different than that single day that led to sort of 3x5 taking off.
Yeah, if I could just jump in, Sophia, sorry, because Greg was directly speaking. Just to say, I fully agree with what he just said. And those triple billion targets, firstly, are inspired by 3x5, but it's kind of measurable impact across everything that WHO does. But Greg was really speaking to the engagement side and participation and ownership and leadership of different sectors working together, including civil society. And I think, or especially civil society. And I just want to say, I think maybe more than any Director General, Tedros has emphasized the fact that to solve these global challenges, we need to work together. Regularly is engaging with hundreds of civil society leaders on a regular basis, et cetera. I know that more needs to be done. And Rajat highlighted some of those issues. But what I really wanted to do is just agree with what Greg was saying, because the only way to solve these global challenges is for leaders from different sectors to work together as equals. And since we're at a CUGH thing, I just want to say that WHO is us, WHO is you, WHO is every single person listening to this, every single resident, every single intern, every single faculty member in the academic setting, every single community practitioner. It's all of us. And so Greg's comments apply to civil society, shall we say, more generally, including the academic sectors, and civil society is us. Civil society is us, but WHO is us, WHO is you. Just to fully agree, and this is echoing Tedros' message, we will not solve global challenges unless we solve them together. And I think he has really taken that position and taken serious steps to implement it. And of course, more needs to be done, as Rajat and Greg were saying.
So I want to start moving towards some of the questions that have come in. And one question, Greg, came to you directly, but I think it's really a question for everyone, if I can, which is really about the role of funding agencies, right? And so the question is specifically in terms of the Center for Global Mental Health Research and at NIH, it's like how to effectively incorporate human rights framework in required deliverables, and how to think about the ways in which these things, particularly in the context of access to care, could be integrated. But I think the question I'd like to ask all of you is, what's the role of funding agencies in this? What is the role of funding agencies to help move us forward? Rajat?
I have my own views, and I'll share with you that I think the only way to address, the catalog of challenges that people may think WHO confronts is by making it financially independent. And I think the moment we take a serious turn on these issues and provide it funding which matches its mandate, I think we will solve a lot of challenges that we are talking about today. Unfortunately, it's not the case. Unfortunately, countries play politics with assessed contributions for WHO. Countries withhold assessed contributions to WHO. Some countries withdraw assessed contributions to the organization because the organization is not doing what they think should be done on global health. Now, that's not how it's going to work. If you are serious about this being the world's normative agency on health, you need to be ready to have the agency make uncomfortable decisions, which might upset your domestic constituencies, but that is what the mandate you have given it to them. So the role of funding agencies, I would say, has to move into the direction of providing WHO with a corpus of unrestricted funding that enables its hand to deliver on the agenda and stop playing politics with that.
Thank you for that. Greg, please.
So I'm just looking at the chat. I mean, I talked to the implementation science of human rights, and I sort of made it up on the spot. But as I'm thinking about it, if you were a funding agency like NIH and you're interested in global mental health goals, in alignment with the WHO's goals, you could set a set of indicators, not about human rights achievements, but policy achievements. what is the, what kind of access do we have to, I mean, I'm not a mental health expert, so I can't, like treatment for depression, I'll just say, and set out some short-term and long-term goals about how they might be achieved. And then think about how you can actualize them, right? What actually creates policy change at a local level or a regional level, right? Is it, and it's so, and maybe it's not, the NIH probably doesn't think this is a great idea because it's mostly social science. It's sociology and anthropology and understanding of social movements. How could the Treat and Action Campaign have done better in its work on securing antiretroviral therapy in that country? How could that have been translated across the region in a more speedy fashion? It's an implementation science of politics, not necessarily of human rights. NIH is never going to do that, but somebody has to sort of give us an architecture to understand how we can achieve human rights, not just sort of measure the violations or achievements in them, whether the right to health or anything else, but how do we actually do the work? Nobody really is quite sure about how do you achieve these things. Most of it is by the seat of our pants, right? Like social movements arise out of sort of specific local need in a point in time, but it's never being optimized or thought about how it could be done better or how it could be taken to scale, because nobody thinks it's important, at least from a funding perspective. And look at what happens to private funders, Gates Foundation, Rockefeller, et cetera. Lots of the AIDS groups who did all this amazing work in the early 2000s, have closed shop, shut their doors. Even Fatima's organization, the Health Justice Initiative, was struggling for funding, even though she was doing the central work around vaccine access for the past 2 years. So nobody really thinks this sort of work is important. But I think studying it maybe because I'm a scientist, but like to think that there's a science to activism and policy change to achieve what we need to do, whether it's an SDG or a human rights target.
Super helpful. Yeah, Peter, go ahead.
Yeah, so just very briefly on the issue of WHO funding, I think Rajat has made the case, and it follows from the earlier bits of the discussion. There's a very strong focus now on sustainable finance. That begins with the quality of funding. Less than 20% of the funding is flexible. So, it's very hard to actually live your mission if you can't shift your money around. And so would just encourage everyone listening to inform themselves and perhaps help with the idea of sustainable funding. And what I mean is, encouraging governments, et cetera, on sustainable funding. But I won't say more about WHO funding because Rajat did a good job. I was a funder for 10 years. I was the CEO of a funding organization. And I think that to your question, Sofia, the principal job of a funding organization is humility. And that might sound a little weird, but when you have money, you have power. And people with money have more power than people with ideas. And it's very easy to become arrogant and tell people what their needs are. And then people don't always say what their needs are because they want your money. And so you have to double your efforts to be humble. And that applies to funding organizations right across the board. It's kind of a strange answer to your question, I think. But it's certainly the single biggest lesson that I learned with the privilege of actually leading a significant innovation funding organization. And this ties into inclusiveness and who is actually setting the agenda and who the innovators are. And so let me just give you a concrete example. You talked about mental health. There's an innovator, and I think hopefully this will appeal to the folks listening who are in the university community as well. There's an innovator in the psychiatry department in University in Harare who developed the Friendship Edge, which is essentially doing cognitive behavioral therapy with grandmothers in a culturally adaptive way in Shona culture in Zimbabwe for common mental illnesses. And by the way, that correlates to WHO's kind of scaling treatment things on mental health in the action plan. He's reached about 70,000 people. Grand Challenges Canada funded him to do his randomized trial that showed it was highly effective, and then to scale. But the question is, how do you get from 70,000 people to 7 million people? And that has to do with shifting from the push of funders to the pull of governments in part. And so how do you take that example of the Friendship Edge and integrate it into primary healthcare, for example, in this case in Zimbabwe, so it can really scale? And that is a place that WHO country offices. Another real comparative advantage of WHO is 152 country offices, and the social capital with governments can really help by identifying innovations like that, by working with governments to scale them, and by sharing them country to country. Because scaling innovation is a way to accelerate progress on the SDGs. The SDGs are lacking, including and especially in mental health, as we discussed. And there's a concrete example, starting with funders, but also innovators, governments, multilaterals, and implementation scientists, like people listening on this call. And it's a social and delivery innovation, like what many people are involved in here. So everything together, from human rights and the right to access to mental health services, through to innovation, funding, multilateralism, come together in that example. And it is a good example for what needs to happen, which is finding ways to accelerate progress. Because if we go at the current rate, we'll never reach the Sustainable Development Goals.
So I'd like to do one last round, and I'm going to try to collect a number of the questions that are there, in the hopes that each of you can pick and choose which of these you'd like to kind of react to. The first question has to do with moving towards decolonizing of global health. And the question is about the implications of this movement, both in theory and practice, for the nexus of public health and human rights, and particularly how human rights can be perceived as supportive of this, rather than as a form of colonialism to be contested. A second question I want to throw out to you is coming from a younger practitioner researcher just starting out, who's feeling a bit disheartened by hearing about all of the inequalities that have been discussed on this panel. And what advice that you would have for somebody who cares about these issues and is just starting out, and how to get engaged and how to think about this. And then my framing question to that is, what could a global health agenda based on human rights look like for the future? I would really appreciate each of your reflections around those questions, if you can. Take it as you like. Rajat, you are the first person to look up, so you are the first person I'm going to call on.
Thanks, Sofia, with not at all with any sense of answers to all those three very rich questions, and we can spend a whole conversation around each of them. But let me start with the second one, for a young colleague who's feeling disappointed. What I want to say is don't feel disappointed, because the hope lies with you. Actually, the hope lies with folks like you who could have just chosen to do anything else, 100 different things, but you chose to come and join and reflect on this conversation with us, and that gives me hope. That gives me hope that there are people like you out there who will do what Gregg was calling upon us to do, is to work towards social mobilization in each of our personal spheres and to effect the change. Because Joshua Wong, the Hong Kong activist, when he was being arrested and taken into detention, he said something outside the courthouse which stuck with me, was saying, hang in there, be okay. And I think I would like to leave with that sense of optimism that we will be okay. There are larger questions. I completely agree with the point that Stephen, you made about coloniality and how do we situate these conversations. And I take the framing of human rights and its historical underpinning as separated from the idea of justice. And what I would want to do is to work from the context of social justice as something that underpins the conversations that we are having, and to embark upon that. And of course, there are differences, and of course, there are many would argue, including myself, is that the origins of it and how do we decolonize it. But I wouldn't stop there. I think what has, as a consequence from treatment action campaign, from polio campaign, from a lot of other examples, gives a lot of hope on how we are able to come to human rights from that perspective. Still doesn't answer your question, Sofia. What does it mean for the future?
That's
But
okay.
for Greg and Peter.
Thank you. Thank you. Greg, please, closing thoughts.
So I want to talk to this young person too, because, you know, I'm doom and gloom and I'm angry, but like one of the most hopeful things of the past 2 years is all the people I've met across the world who are aligned with us on everything we've been talking about today. There's a huge community of people who want to do good, who want to realize health for all, human rights for all. It's really astounding the number of people I've met. I've met a lot of people in my life, right? And so I would say don't mourn, but organize, right? Find other students at your university or your college and start to think about how you can make local impact, regional impact, national impact. We don't have to finish the work in our lifetimes, but we can't abandon it either, right? It's an old saying from the Talmud, but the point is like, get to work, right? It's if you didn't feel the sadness, you know, you wouldn't be human, because this has been a terrible 2 years. But really sort of pull together with a few people and try to figure out how you're going to change things in your university, in your town, in your state or province, or in your country, and then think about the world after that.
Thanks. Peter, last word.
I'll just say, riffing off what my friends Rajat and Greg said, and to that young person, agree, that's where the hope is. You have agency. Equity is in your hands. It's not something that happens to you. It's something that you can develop and create. And my top line advice to young people is find a problem and solve it. Find a problem and solve it. And it's as simple as that. And then go on to solving more and more important problems. Don't define your career as the titles you have or the roles that you play. Define your career as the problems you've solved and the people that you've helped. And that's really, I think, the top line advice. And just very briefly on the decolonization thing, just to say that inclusiveness agenda is so important. And we have a lot of lessons to learn in global health, for example, from our Indigenous colleagues. And Indigenous ways of knowing and being can really be highly, and the terrible experience of Indigenous people in many countries around the world. Their ways of knowing and being can be highly informative to the, let's say, decolonizing agenda in global health. So that provides a concrete direction, I think, to work with our Indigenous colleagues to learn some of those lessons and translate them. But to the young person, find a problem and solve it, and the world will be better for it. And that's actually where I think all of our hope lies. Thank you.
Thank you. And I think that's advice for us all, right? And so with that, I just want to thank each of you for this amazing session, and Pascale and at the beginning, but for all of you, thank you for this amazing session. Thank you to you, the audience, for joining us. And on behalf of all the co-organizers, wish everybody all the best for the coming days. And again, let's just keep doing the work. All right, take care, everyone.